For an elderly patient, it's very difficult to go into transplant. So going back to your first question, is there a potential role for chemo-free strategy in ALL? So as I see it, the possibility would be yes. We have to prove it, but at least we've shown that we can put patients into remission. Some patients obtain even a molecular remission. The key point is to become what we call MRD negative, molecular negativity. So now we're combining new drugs, so a tyrosine kinase inhibitor plus very fancy immunotherapy now. It's an era of immunotherapy. Wherever you go, you read the newspapers, the journals, or CAR-T, whatever. So the Italian study is just about the first, is for the Philadelphia, incorporating the bispecific monoclonal antibody blinatumomab, which is anti-CD3 and anti-CD19, so targeting the leukemic cells, CD19, but it's immunotherapy, it's activating the T cells of the patient that goes against the CD19 positive leukemic cells. So we give an induction with a steroid and a tyrosine kinase inhibitor, and we are consolidating with the antibody. So it's induction consolidation without chemotherapy. And the primary endpoint of this is the percent of patients who are going to become sustained MRD negative by quantitative PCR. And what will be the final goal? To reduce the number of transplant, and particularly in the elderly, maybe to control the disease. I will show tomorrow when I speak, I'll start, here they want the case. So I'll show tomorrow a case of a gentleman who in 2007 or 8, I can't remember off by heart, was diagnosed with ALL at the age of 89. 89, even today quite mature. Luckily he was tested. Because in many places you wouldn't do that because so old you say, well, acute leukemia, what is the prognosis? Luckily he was tested in a GMEMA and he was Philadelphia positive. So he was put on an inhibitor, went into remission. He was driving a car in Verona, not in Rome, this was in Verona. Then eventually he relapsed 1.5 years later. We put him on a second inhibitor, attained a second remission. To make a long story short, the gentleman lived 2.5 years. He turned 90, turned 91, and eventually died. So he had 2.5 years with an acute leukemia, lymphoid leukemia. And now if he hadn't been diagnosed having the Philadelphia, he would have died in 3 months. So that gives an example of targeted treatment even in a lethal condition like this, even in a very elderly patient. And he's not the only one, now we're treating many patients.